How much protein should kidney patients eat? When it comes to kidney health, one common question is about protein intake. For individuals with kidney disease, the amount of protein they should consume can vary greatly depending on the stage of their chronic kidney disease and whether they are undergoing dialysis. Understanding these differences is crucial for promoting kidney health and preventing further damage. In the early stages of chronic kidney disease, specifically stages 1 and 2, patients are usually advised to limit their protein intake to about 0.8 grams per kilogram of ideal body weight each day. For example, if someone weighs around 68 kilograms, which is about 150 pounds, they should aim for no more than 54 grams of protein daily. During this stage, focusing on plant-based proteins can be beneficial, as they tend to produce less waste compared to animal proteins. As kidney disease progresses to moderate and advanced stages, particularly stages 3 to 5, the recommended protein intake decreases further. In these cases, patients are often advised to consume around 0.55 to 0.6 grams of protein per kilogram of body weight daily. For that same 68 kilogram individual, this would translate to roughly 37 to 41 grams of protein each day. This modest restriction helps slow the progression of kidney damage while also minimizing the risk of malnutrition, provided that caloric intake remains adequate. For patients with chronic kidney disease who also have diabetes, a slightly higher protein intake may be appropriate. In these cases, around 0.8 to 0.9 grams per kilogram can help balance the need for kidney protection with nutritional requirements. Now, for those on dialysis, the situation changes quite a bit. Dialysis can remove some proteins from the blood, which means that these patients typically requiring more protein to maintain their nutritional status. The recommended intake for dialysis patients is around 1.2 to 1.5 grams of protein per kilogram of body weight each day. For a patient weighing 60 kilograms, this could mean needing between 72 to 90 grams of protein daily to compensate for losses. It is also important to consider the quality of protein consumed. High biologic value proteins, which contain all essential amino acids, are preferred to meet nutritional needs efficiently. Individualized dietary plans are essential, as protein needs can vary based on weight, kidney function, presence of diabetes, and overall nutritional status. Consulting with a renal dietitian can provide personalized guidance tailored to each patient's unique situation. While it is crucial to manage protein intake, it is equally important to ensure that adequate calories from carbohydrates and fats are consumed. This helps prevent muscle wasting and malnutrition, especially when protein is restricted. For patients with kidney cancer, nutritional needs can differ based on treatment and kidney function. Therefore, protein intake should be adjusted accordingly under medical supervision. In summary, kidney patients should carefully moderate their protein intake based on their stage of chronic kidney disease and treatment. Early stages typically requiring about 0.8 grams per kilogram daily. Advanced stages may need around 0.55 to 0.6 grams, and dialysis patients often requiring increased protein intake of about 1.2 to 1.5 grams per kilogram. Always consult healthcare professionals for personalized dietary advice to optimize health outcomes.